This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome to the 21st Century Man podcast. This is the show where we take a deep dive, chapter by chapter, straight from the experts in the book, The 21st Century Man.
Glad to be diving in again.
Today, we are turning our focus to chapter 85. Now, this one's titled, When a Penile Implant is the Best Option. And it's authored by two very well-respected urologists, Dr. Edward Cartman and Dr. Judson Brandeis.
That's right. And this chapter, it really gets into a treatment path for erectile dysfunction that, for a certain group of men, it's not just an option. It's often really the most effective one, the most satisfying one they have available.
Okay.
It's a deep look at a solution for when those, more common treatments just don't cut it.
Right. So our goal for you listening is to really unpack everything this chapter covers. We want to get into exactly who is this option for, who's the ideal candidate, explore the technology behind it, how it actually works, talk about the potential things to consider, the risks maybe.
Yeah, definitely.
And I think really importantly, understand the huge impact it can have on a man's life, on his relationships. And the chapter uses a really powerful personal story to show that.
It does. Dale's story is quite something.
So it's really about, cutting through maybe some myths or misunderstandings and getting to the reality of this medical option.
Absolutely. It's about seeing that for men who are dealing with persistent ED, maybe especially after certain medical treatments like surgery for cancer, this isn't just, a physical fix. It's often a way to get back a really vital part of their life, their intimacy.
Okay, so let's really get into what this chapter wants us to understand. Let's unpack it.
Okay. So right from the start, the chapter makes it clear that we're talking about penile implants when other ways of treating ED have already been, tried and haven't worked well enough, or maybe they're just not suitable for that particular man.
So it's not the first thing you jump to.
No, definitely not. It's looking at the challenges when those, let's call them more conservative approaches, just aren't getting the job done.
And the chapter seems pretty specific about who those men are, doesn't it? It kind of defines the candidates.
It does, yeah. It highlights, for instance, men who maybe have other health issues, or they're taking certain medications that mean they actually can't safely use those common ED pills, like Viagra or Cialis.
So there are contraindications.
Exactly. The risks just make those pills off limits for them.
Okay, that makes sense.
And then beyond those guys, there's another group, men who can take the pills, but they just don't find them effective.
They don't work for them.
Right. I mean, these drugs are great for a lot of men, but they're not a magic bullet for everyone. For some, the way their ED works physiologically, the pills just aren't enough to get, a functional erection.
And that's a key point. It's not about not wanting to take pills. It's about the body not responding.
Precisely. It's a physiological response issue.
And then there's a third group mentioned, the one that kind of ties into the story we'll talk about later, Dale's story.
Yeah, this is a really important one. These are men who might find other options like injections directly into the penis. Well, they might find those options tough, either physically or, psychologically.
Yeah, I can imagine the idea of an injection every time.
Right. Even though those injections can work really well, the thought of having to do that before every single time you want to be intimate, that's a hurdle for a lot of guys. Yeah. The chapter acknowledges that, that practical side, that emotional side.
So it really paints a picture of men who've kind of run the course with other standard treatments and are still left with significant ED.
That's the context. The implant discussion starts when those other paths are, either exhausted or they've been ruled out for good reasons.
Now, one thing that struck me early in the chapter is that this isn't exactly like brand new tech, is it? It mentions these have been around for a while.
Yeah, that's a really great point the chapter makes. This isn't some, experimental thing. Penile prostheses, as they're formally called, have actually been used to treat ED since the 1950s.
The 1950s, wow.
Yeah. So that history is really important. It means these devices aren't first generation. They've gone through, decades of research, development, improvements.
Refining the materials, the design.
Exactly. Materials, design, the surgical techniques, the outcomes. We're talking over half a century of evolution here. It's a pretty mature technology.
Okay, that's reassuring to know. It's not something they just cooked up.
Not at all.
And the chapter also points out it's not just for standard ED, right? It mentions another condition, Peyronie's disease.
Yeah, that's a significant application. So Peyronie's disease,
Mhm.
this is where fibrous scar tissue forms inside the penis in the sheath around the erectile tissues called the tunica albuginea.
Okay.
And this scar tissue, it doesn't stretch like the healthy tissue does. So it can lead to, well, painful erections, a noticeable curve or bend in the penis, and often it messes with erectile function too.
Right. So it causes curvature in ED potentially.
Correct. So for men who have both Peyronie's and ED, the implant can actually do two things at once. Yeah, it provides the rigidity needed for sex, obviously, but the process of putting the implant cylinders in can also help physically straighten the penis, kind of counteracting the curve from the scar tissue.
Wow. Okay. So it tackles both problems, the erection and the shape.
Exactly. It's a really valuable approach for those specific patients.
That's quite an advantage. Now, the chapter does mention one sort of practical thing needed for someone considering this, right? Something about their hands.
Ah, yes, manual dexterity. That's definitely something they check during the evaluation.
Why is that so important?
Well, the most common type of implant, the inflatable one, which we'll get into, it relies on a little pump mechanism that the man operates himself to, inflate and deflate it.
Okay.
So you need to have decent use of your hands and fingers to work that pump effectively. If someone has, say, severe arthritis or another condition that really impacts their hand function, the inflatable type might be tricky.
Gotcha. So that's part of the screening process.
Definitely. Though there might be alternatives or maybe modified techniques, it's a key consideration for the inflatable type.
Okay. Now, this next part. This is where the chapter hits you with a statistic that really, honestly made me sit up. It's about satisfaction rates.
Mm-hmm. This is probably the headline finding, really.
It references research, Dr. Gregory Barton in Sexual Medicine Reviews 2019, saying patient satisfaction rates are super high, like higher than 85%.
Yeah, and then later on, it actually bumps that number up even higher, saying patient satisfaction is more than 90%.
More than 90%. That just seems incredibly high for any medical procedure, let alone something dealing with sexual function.
It is remarkable, and the chapter really emphasizes why it's so significant. It states flat out that this is the highest satisfaction rate of all treatment options for erectile dysfunction.
Higher than pills, higher than injections.
That's what the data suggests, yeah. When you look at the whole picture for those other treatments, effectiveness, side effects, the spontaneity issue, sticking with it long term, they don't typically hit that 90+% satisfaction mark consistently.
So for the specific group of men who end up choosing an implant, the ones where other things didn't work or weren't an option.
Right. For that population, the chapter is saying the implant delivers a level of reliable, predictable function that leads to this dramatic improvement in their quality of life, and importantly, their partner's quality of life too. The chapter makes point of including the partner.
That's crucial, isn't it? Because ED isn't just one person's problem.
Absolutely not. It affects the relationship profoundly. So for these men who've often struggled for years, the implant is frequently the thing that finally brings back a level of, sexual confidence, spontaneity, connection that they thought was lost. That drives those high satisfaction numbers.
It really sets the stage for why this is considered such a valuable option in those specific cases.
It validates the procedure's place when other therapies just aren't enough. It's the outcome measure that matters most.
And to really bring this home, the chapter tells Dale's story.
Dale's story is presented as, a kind of case study illustrating the journey.
So tell us about Dale. What's his background, according to the chapter?
Well, he's described as being 52 years old, married for a long time, 25 years, has 3 kids, professionally successful, involved in his community. Just seems like a regular, relatable guy leading a pretty full life.
Okay. And then things change for him.
Yeah. He gets hit with a serious medical diagnosis, prostate cancer. And the chapter specifies it was a Gleason score of 8.
Which is quite aggressive, right?
It is, yeah. And adding to that weight, the chapter includes this really poignant detail that Dale remembered his own father having battled and ultimately died from the same disease.
Oh, wow. That must have made the diagnosis incredibly scary.
You have to imagine so. That personal history puts a whole different spin on facing that diagnosis and deciding what to do.
So what did he decide? What treatment did he go for?
Well, given the seriousness in that family history, he opted for curative treatment. The chapter says he went to a top surgeon and had a radical prostatectomy. That's the complete surgical removal of the prostate gland.
With the goal of getting rid of the cancer completely.
Exactly. And the good news, the primary goal was achieved. The surgery was successful, the cancer was cured.
Okay, that's fantastic. But there was a downside.
Unfortunately, yes. As the chapter explains it, this life-saving surgery had a significant, though known, side effect. It details how the nerves that run right alongside the prostate nerves that are absolutely crucial for starting the whole process of getting an erection, those nerves had to be removed during the surgery to make sure all the cancer was gone.
And that nerve removal directly caused
his erectile dysfunction after the surgery. It's a tough trade-off surgeons sometimes face to ensure the cancer is fully treated.
So what did that mean for Dale and his wife?
Well, the chapter describes the result as 2 years. 2 years, where physical intimacy was just gone from their marriage.
2 whole years. That's a long time.
It really emphasizes the persistence of the problem and the void that creates in a long-term relationship.
And the chapter touches on the emotional side too, right? Like how they dealt with it.
Yeah, it mentions Dale felt reluctant to talk about it openly, which is common. But he also sensed that his wife was feeling that loss of connection just as much as he was. That kind of unspoken understanding or maybe misunderstanding is a really powerful part of the story.
So this situation makes Dale a prime candidate based on what we discussed earlier.
Exactly. His situation lines up perfectly with the criteria the chapter laid out. It explicitly says he had tried Viagra and it hadn't worked for him.
Right. Pills weren't effective.
And importantly, he was hesitant, reluctant to go down the road of using injections every single time he wanted to be intimate. He needed something more reliable, less demanding in the moment.
So what was his next step? Did he bring it up?
He did. The chapter highlights his courage in actually asking his urologist about the possibility of an implant.
That takes guts, I imagine.
It does, and his urologist did the right thing, recognized it's a specialized procedure, and referred him to another urologist who was an expert, someone with a lot of experience specifically in implant surgery.
That referral seems key, finding someone who really knows what they're doing.
Absolutely. The chapter implies that by detailing the referral process, skill matters here.
So what was the surgery itself like for Dale, according to the chapter?
Well, the description makes it sound, maybe surprisingly, quite straightforward. The actual operation itself took less than an hour.
Under an hour.
Yep, and he went home the same day.
Wow. Less than an hour and same-day discharge. That's faster than I would have guessed. What about the recovery right after? Was it rough?
The chapter notes he needed pain medication for about 3 or 4 days, and he felt pretty sore for around a week.
Okay, so some definite discomfort for a week or so.
But it also points out something practical. Dale was an accountant, and he was able to work from home during that week.
Ah, okay. So maybe not completely laid up, depending on your job.
Right. It suggests that while you're sore, you might still be functional for less physical types of work.
That's useful context. So how long did he have to wait before he could, actually use the implant?
The chapter says he went back for his final checkup 6 weeks after the surgery. That's typically when the green light is given.
6 weeks, okay.
But here's a really crucial detail the chapter includes. Dale didn't just wait for the okay. He was proactive. He watched videos. He really made an effort to learn exactly how the implant worked, how to operate it.
He did his homework.
He did. And the chapter presents this preparation as a key factor in his eventual success. It wasn't just the surgeon's skill, it was his own engagement, too.
That's a great takeaway for anyone considering this. Understanding the device is part of the process.
Definitely.
And then the chapter describes the moment he reconnected with his wife.
Yeah, this part of the story is, it's quite moving, actually. He takes his wife out for dinner, sets the scene for a real conversation, and the chapter says he just opened up really honestly. Confessed how difficult, how emotionally taxing those last 2 years without intimacy had been for him.
Showing that vulnerability.
Exactly. Bridging that gap that the ED had created between them.
And how did his wife react?
According to the chapter, she was completely understanding, and she shared her side too, confiding how much she had missed that physical closeness, that connection.
So it was a shared loss they both felt.
Absolutely. It confirms it wasn't just his problem. It was impacting their whole relationship, 25 years of marriage. That conversation seems like a really important step in the healing process described.
A turning point.
You could say that.
Yeah.
And then later that night, the chapter gets into the details of them using the implant for the first time together.
Okay. How did that go?
Well, it's described with a lot of honesty about the sort of physical realities.
Yeah.
It mentions his penis seems slightly shorter than they remembered.
Oh, interesting.
Yeah. And also that the head of the penis was a little floppy.
Okay, so it wasn't exactly like a natural erection in every single way.
That's what the detail suggests. It's an important nuance the chapter includes, acknowledging there can be subtle physical differences compared to how things were before. Potential patients should probably be aware of that.
Good to know. Did they need to make any adjustments?
Yes, the chapter mentions one practical thing. They used a silicone-based lubricant that the urologist had recommended.
Ah, okay. So maybe some simple aids or tips from the doctor can help optimize things.
Seems like it. It highlights that role of follow-up advice, being prepared for little adjustments.
But then, how did it feel? What was the outcome of that first time after 2 years?
This is where the story takes a really positive turn. The chapter says once he was inside, it felt just like the old days.
Okay, that's great.
But then it adds this really fascinating, kind of unexpected detail. It says, in fact, it may have even been better.
Better. How could it be better? What did the chapter say about that?
Well, it attributes this better feeling, at least partly, to something related to ejaculation control. Apparently, before his ED, Dale sometimes had issues with climaxing too early.
Premature ejaculation.
Right. But with the implant, because the rigidity is there mechanically, independent of his own internal triggers for climax, the chapter says it seemed like he could go forever.
Wow. So the implant, by basically guaranteeing the erection stays firm, might have inadvertently helped his control.
That's the implication from Dale's experience as told in the chapter. It suggests a potential, maybe unexpected, secondary benefit for men who might have both ED and premature ejaculation issues.
That's a really remarkable outcome highlighted there.
It is.
So the end of Dale's story in the chapter is they reconnected.
Fully reconnected. That's the powerful conclusion. After 2 long years of waiting and difficulty, the implant allowed them to restore that deeply missed intimacy. His story really serves as that compelling real-world example of the chapter's main points: high satisfaction, improved quality of life for both partners.
It absolutely puts a human face on those 90+% statistics. Shows you what that number actually means in someone's life. Okay, fantastic illustration. Let's shift gears now and dig a bit more into the technology itself. The chapter breaks down the 2 main types of implants used.
Right. It focuses on the 2 main categories that are available. The first one, and this is the one used most often by far, is the inflatable penile implant.
Inflatable. Okay, how common is it?
The chapter states that roughly 90% of all implants put in are this inflatable type.
90%. So it's really the standard. Why is it so dominant?
Well, the chapter explains its main design goal is to mimic the natural penis function as closely as possible. So it gives you rigidity when you want it, but it also allows you to return to a completely flaccid, soft state when you're not using it.
So it looks and feels more natural when not in use.
Exactly. That cosmetic aspect and the functional aspect of being able to be flaccid, that's a really big deal for most men.
Makes sense. Can you walk us through the parts of this inflatable system? What's involved?
Sure. It's basically got 3 main components. First, you have 2 hollow cylinders.
Okay. Where do those go?
Those are the parts that actually fill up with fluid to make the erection happen. The chapter explains they're surgically placed inside the corpora cavernosa.
Which are?
Those are the natural, sort of spongy, erectile chambers in the penis that normally fill with blood during an erection. The cylinders basically sit inside and expand those chambers.
Gotcha. Cylinders inside the penis. What else?
Second key part is the pump. The chapter says this little pump is placed surgically down in the scrotum.
In the scrotum?
Yeah, it uses that vivid description like a third testicle. That's the control unit. That's what the man actually uses to inflate and deflate the device.
Okay. Cylinders, pump in the scrotum. Where does the fluid come from? There must be fluid.
There is. It's usually just saline solution. And that fluid is stored in the third component, which is a reservoir.
A reservoir. Where does that sit?
The chapter mentions it's part of the system. It doesn't go into huge detail on placement variations. It's implied it's connected by tubing, and it's usually placed discreetly inside the body, often in the lower abdomen, maybe behind the pubic bone or under the abdominal muscles. It's basically the holding tank for the saline.
Okay, so cylinders, pump, reservoir, all connected. How does a man actually, make it work? How does he get an erection with it?
The chapter explains it pretty clearly. To get rigidity, the man repeatedly squeezes that pump down in his scrotum.
Okay.
Each squeeze pushes the saline fluid out of the reservoir, through the connecting tubes, and into those 2 cylinders inside the penis.
Filling them up.
Exactly. As the cylinders fill and expand, the penis becomes firm and erect, ready for intercourse. You just keep pumping until you get the firmness you want.
It sounds quite controlled, like you're manually creating it.
It is. It's user-controlled inflation.
And then afterwards, how does it go back down? How do you get flaccid again?
Well, that scrotal pump isn't just for inflating. The chapter says it also has a deflation valve mechanism built into it. So to deflate, the man presses a specific spot on the pump, activating that valve. When he does that, the fluid flows back out of the cylinders, through the tubing, and returns to the reservoir. The cylinder's empty, and the penis becomes soft and flaccid again.
So the inflatable really offers that on-demand function and the return to a natural flaccid state. What about the other type the chapter mentioned, the less common one?
Right. The second type is the semi-rigid, or sometimes called malleable, penile implant. The chapter notes these make up a much smaller slice of the pie, less than 10% of all implants.
Less than 10%. Okay.
Right.
And how are these different? No pump.
No pump, no reservoir, no inflating cylinders like the other type. The chapter describes them more simply as basically being a pair of semi-rigid rods that are placed inside the corpora cavernosa.
Semi-rigid rods.
Yeah.
So they're always firm.
Essentially, yes, that's the defining characteristic. They provide constant firmness.
What's the main advantage of that type then, according to the chapter?
The chapter points to ease of use as the key benefit. Because there's no pump or valve to operate, they're always, in a sense, ready. Just position and go.
Okay.
This could be good for men who have really significant issues with hand dexterity, making operating the inflatable pump difficult. Although, even with these, you still need some dexterity to position the penis for intercourse.
Right. But the big difference, and maybe why they're less popular, is that permanent firmness.
That's the main trade-off, yes. The penis is always firm. Now, they are malleable, meaning you can bend the penis downwards, usually against the body, to conceal it under clothing.
Okay.
But it doesn't return to that truly soft, flaccid state like the inflatable does. And for many men, that ability to look and feel completely flaccid when not intimate is a really strong preference. That likely drives the market share difference, the chapter notes.
That makes a lot of sense. So you have the inflatable mimicking natural states more closely, and the semi-rigid, simpler to use but always firm.
Those are the two main options described, yeah.
Now, the chapter is also realistic about potential downsides. It does discuss risks associated with the surgery, doesn't it?
It does, yeah. It's important to have that balanced picture. Like, anytime you have surgery and implant a foreign object in the body, there are risks. And the chapter specifically flags infection as the main concern.
Infection, okay. And does it mention if some people are at higher risk?
It does. It specifically points out that men who have diabetes are at a somewhat higher risk of bacterial infections after this kind of surgery.
Why is that?
It's likely due to a few factors often linked with diabetes, like maybe slightly impaired immune function or slower wound healing. It just means that careful patient selection and really good post-op management are extra important for diabetic patients.
Okay, so infection is the main risk, particularly for diabetics. How does modern medicine deal with that risk? Does the chapter mention any advancements?
Yes, definitely. It highlights progress in the implant technology itself that's designed to fight infection. It explains that newer implants often come with special antibiotic coatings.
Antibiotic coatings on the implant itself.
Exactly. These coatings are designed to release antibiotics right there around the device locally in that crucial period right after surgery. It creates this kind of protective shield that makes it much harder for bacteria to get a foothold and start an infection.
That sounds like a smart innovation.
It's made a big difference.
So, with these advancements in careful surgery, what does the chapter say the actual infection rate is nowadays?
It gives a pretty clear number. Typical infection rates are stated to be less than 2%.
Less than 2%. Wow. Considering you're putting a whole device in there and the higher risk for some, less than 2% feels really quite low.
It is remarkably low. It really speaks to how refined the surgical techniques have become, the importance of patient selection, and the effectiveness of things like those antibiotic coatings.
So while infection is definitely something you have to be aware of and discuss,
Absolutely. It's a serious potential complication.
the chapter's data suggests it's actually a relatively uncommon event with experienced surgeons and modern implants.
That's the takeaway. It's a risk that's been significantly minimized, especially when you weigh it against the potential benefits restoring function intimacy for the right person.
Okay, so putting all this information together, the who, the why, the how, the risks, the chapter kind of sums things up in a key takeaways section, right?
It does, yeah. It boils down the most critical points the authors, Dr. Cartman and Dr. Brandeis, really want you to remember.
And what's the first big takeaway?
Well, it comes right back to that statistic we talked about. It hammers home that the successful placement of a penile implant has the highest satisfaction rate of all treatment options for erectile dysfunction.
That point is just so central to the whole chapter, isn't it? It really bears repeating. For the men who get to this stage, this option offers the best chance of being satisfied with the outcome.
That's the core message.
Yeah.
And the chapter then emphasizes what that successful outcome looks like. Penile implants have allowed men to have erections that are effective, reliable, and cosmetically acceptable.
Let's just quickly break down those three words from the takeaway. Effective, meaning it actually works, produces rigidity for intercourse.
Right.
Reliable, meaning it works when you want it to, on demand. Unlike natural erections, that might be unpredictable or just not happening for these men.
Predictability is huge.
And cosmetically acceptable, meaning, like we heard with Dale, even if there may be tiny differences, the overall look and feel is natural enough for comfortable intimacy and confidence.
Exactly. These are the three pillars of success the chapter describes. Works well, works whenever needed, and looks okay. The implant is positioned as achieving all three for the carefully selected patient.
This whole deep dive into Chapter 85 has been really, really insightful. We've gone from understanding who this is for and why they might need it, to how the tech works, the personal impact through Dale's story, and the actual results. It really highlights that for men facing these really tough ED challenges where maybe pills failed, injections aren't right, the penile implant isn't some last resort, but actually a very well-established, highly effective medical solution.
With decades of development behind it, and crucially, as the chapter shows with both the data and Dale's story, it leads to these incredibly high satisfaction rates and can really transform quality of life, not just for the man, but for his partner, too.
It's definitely information that men facing these situations and their partners should know exists as a viable, successful option.
Absolutely. Knowledge is power here.
And the book itself, The 21st Century Man, is just packed with this kind of detailed, practical information from real experts on so many topics for men. This chapter is just one piece.
Yeah, we've really only skimmed the surface today. The chapter goes into more detail on surgical techniques, different implant models, nuances of post-op care.
Right. So we definitely encourage you, if this is relevant to you or someone you know, to seek out The 21st Century Man, read Chapter 85 for yourself, get the full picture. And honestly, the whole book is a fantastic resource for understanding all sorts of aspects of men's health and well-being today, straight from experts like Dr. Cartman and Dr. Brandeis.
It really is a valuable guide.
So, just to recap our dive today, we looked at who's a candidate for implants, we walked through Dale's powerful journey, we unpacked the inflatable versus the semi-rigid, touched on the minimal risks with modern approaches, and really hit home that key message from the chapter about the top-tier satisfaction rates.
Yeah, it's a comprehensive look at a treatment that can make a profound difference. It's about giving men the knowledge of the solutions out there and recognizing how much physical health, especially sexual health, connects to emotional well-being and the health of a relationship.
Okay, as we wrap up this deep dive on Chapter 85, here's something for you to think about, pulling directly from the material we discussed. When you consider Dale's story, that 2-year gap after cancer treatment, the loss of intimacy, and then the successful reconnection, maybe even feeling better than before thanks to the implant, and you pair that with those satisfaction rates over 90%, what does that really tell us about the deep, maybe sometimes surprising, link between fixing a physical problem and restoring emotional closeness and intimacy in a relationship?
It's a powerful question.
It really highlights how tackling a physical challenge can send these positive ripples through a man's entire life and partnership. That seems to be a core theme in this chapter's message.
Health really is holistic. It all connects.
Well, thank you so much for joining us for this deep dive into Chapter 85 of The 21st Century Man.
Always a pleasure. Thanks for tuning in.
Please join us next time on the 21st Century Man podcast, where we'll be exploring the very next chapter, Chapter 86, Sex Toys.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.